How do I know that you are for real and not some AI generated?
So anything, overuse or overdose could be a poison. I will say it is real and it is today.
So, if at all there's a war happening between AI and doctors, who do you think will win?
Cloning is good. So the more of Chinnababu is helping other people to learn, disruption can happen. The effects can be dangerous.
So, doctor, if you have to introduce yourself in this today's AI-driven world, how would you say?
That's a great question. But I think I would introduce myself as Chinnababu. AI is my companion, right? So my identity still doesn't change. The me is still Chinnababu, but I am assisted by artificial intelligence.
So, you think that we have to readdress and say it to Dr. Chinnababu 1.0, 2.0 every year?
No, I don't think the me will not change, but the change is with respect to adoption of technology and giving a better care to the patient. I think that's where I am constantly learning and upgrading myself because we are a student for life.
So, before we begin, let me ask you something. How do I know that you are for real and not some AI generated doctor sitting right in front of me?
No, I think the biggest game changer is, with AI and human connection is the human intuition is real. The empathy, the compassion, the personal connection that we have with human touch, what we call, I think that is real and that is the differentiator between AI and the human. So in that sense, it is not just the presence of one thing will eliminate the need for other. I would say both will complement each other and can enhance a personalized and a better care to the patient.
But today, AI can do what not. I mean, it can write articles, it can generate voices. I mean, it also can sound so human. So, when did artificial intelligence come into healthcare sector or the other way around?
See, to be frank, the word artificial intelligence started way back in 1950s. That's when the initial the footsteps and began there. And for the last 20 plus years, we already have some kind of artificial intelligence being used. So, but again, the traction has been built in the last 5 years, and we have been seeing the increasing use of artificial intelligence in healthcare across all spectrums, starting from the radiology and pathology, and then in a big way in oncology these days. This is of great adoption globally now. And today we're living in an era wherein it is no longer a fancy word or something that you need to kind of get feared of, but it is something that will journey with you. It's going to be with you. I mean, so you need to be somebody who will adopt well to the technology and be ready for the transition.
So, it all sounds like we are just one software away from all this confusion.
I think, see, I look at the other way around, the augmentation of the clinician with technology is something that I think it is really, at the end of the day, is there real benefit to the patient is what I look at. And in that sense, if technology is helping the patients live better, have better quality of life, better outcomes, I think that's where, we need to adopt and we need to embrace it.
Tell me honestly, doctor, what's more dangerous, artificial intelligence or natural stupidity?
So both are the extremes today that we are looking at, right? I mean, I think we're living in a world where we have these both, right? So given that, I think mix of both is necessary. Any extremes, only artificial intelligence will not serve the purpose. And natural stupidity is what we are living with today. I think we need to really gear up and use the the gifts that are given to us, the talents that are given us, so that we can give a better care to our patients. So both of them are extremes, and that's the reality today.
So I think it depends on which movie we all watched growing up. So I think AI either destroys humanity or it protects us.
No, see, I think again, as I always say, there is nothing like poison. It all depends on dose. So anything, overuse or overdose could be a poison. So in that sense, there is also dangers and bias and ethical issues. Concerns are real with the AI as well. So I think responsible usage of AI is what will make the difference.
So if we are talking about AI in healthcare today, be it oncology, if we have to talk about, how do you think that's going to be a game change and how do you think that's transforming our lives?
The big change that I see is that it is empowering patients to get a precise or a precision medicine. So more personalized care is possible with technology these days. Just to give a small example, we used to give one size fits all kind of a treatment. So even till just few years ago, anybody with breast cancer stage 2 will get the same type of chemotherapy. Now we have moved on to an era where the therapy is going to be personalized. For each patient, the tumor is analyzed in depth, the genomic analysis is done, the molecular profiling is done with AI, and then looking at a specific target, you give a specific therapy to the patient. So a right patient, right treatment, and the right drug, and that thereby you're giving a much more targeted or a personalized care to the patient. So I think it is empowering us to give precision medicine and also a personalized care to the patient. It is not something that is a hype that is going to come. I will say it is real and it is today.
So when we say AI in healthcare, it's not just robots walking around the hospital, but it's secretly working very intelligently behind the scenes and helping the doctors in a great way.
Absolutely, absolutely. There is so much of complementing and working together. I think that's where there is a big difference, and we are able to really give the best care to our patients. At the end of the day, in healthcare, patient is the decision maker for all of us. Outcomes for the patient outscores everything else.
So talking about adding value to patient care, do you think AI can genuinely detect cancer in early stage and fill that gap?
Yeah, no, definitely. I think that's the right question, Dr. Lakshmi, because early detection helps us in survival rates to be much, much better. We all know that it's proven beyond doubt. So now early detection, AI can help us to be early in early detection. So for example, what can be missed with a human eye on a chest X-ray or a mammography for a screening for a routine lung issues or for a breast cancer screening, the AI can pick up much, much smaller nodules and abnormalities so that you are able to detect the disease very early, and the outcomes are better if you detect the disease early.
So with this, let me ask you, do you think AI can replace doctors?
I think this has been a great question. Everybody is actually scared in a way. I don't think AI will replace doctors. As long as humanity exists, I think there is need for that personal connect. Though artificial intelligence can have some compassion, empathy, all that we talk about, but the human intuition is something that cannot be replaced by anybody else or anything else. That's the reason I say embrace the technology. Those with AI will replace those without AI.
So if at all there's a war happening between AI and doctors, who do you think will win?
Oh my God. No, I don't think, of course, yeah, if you don't use responsible AI, disruption can happen, and the outcomes or the effects can be dangerous. I think that's where AI can lead also if it is not responsibly used, or if you don't have a guardrails. I think that's where a responsible AI with guardrails, with ethics, without bias, I think that's crucial. I mean, you nailed it well, because if there is no control and you just kind of unfold it as it is, I think there could be a real threat.
So was there a day where you thought, oh, AI shouldn't have come into healthcare? Why is it has come?
Honestly, no, Dr. Lakshmi, because if AI can reduce the inequity of healthcare, what else do you want? So I think technology, for anything that comes new, there are always two sides, two facets of it, the uglier side and the brighter side. Now, how do you look at it, a perspective, and how do you use it responsibly? I think that determines.
But don't you think it's easy to clone another Dr. Chinnababu sir with a robot and keeping all the intelligence and skills?
I think digital twin is something that's coming a big way. So all that is fine, but I think the real you is real you. See, your skill sets, if I am able to transfer my skills to multiple people through technology, if I this enabling to bridge that gap, right? So as we were discussing about rural and urban divide, right? If radiologists are not available much in rural areas, pathologists are not available, right? Or even a great surgical skills are not available. If that can be bridged with technology, I think that's where cloning is good. So the more of Chinnababu's helping other people to learn is something I would like that to happen.
So talking about adaptation in AI in healthcare, we all know how visionary and how futuristic your thinking is. And we did this AI in healthcare program, which was a grand success last year. So what's happening this year, and what's there in future for us?
Oh, thank you. I think, last year the International Conference of AI in Healthcare 1.0 was a great success. We had, amazing participation from clinicians, academia, startups, corporates like Google, Microsoft, Triple IT. All of them were part of it. But I think this year we are looking at the conference on June 13th and 14th, which is going to be much bigger and much bolder and much, I would say much grander, because we have great participation from Google core team from Mountain View are going to come and join us. Mr. Yossi Matthias is the Google research head, and of course we have Chendu Tota, the vice president at Google, and Dr. Peter Cladis, again Google Health Director. So all these great speakers are coming from the head office of Google. We have a participation from Microsoft. We have Triple IT Hyderabad supporting us in a big way. ISB is with us. And of course, we also have a rich collaboration with for the startup AI Innovation Challenge that we every year conduct. That is again for the young entrepreneurs is going to be a great boon. And of course, we also have a wonderful support and participation from various other organizations, including the FABA and K Square and you name it, including Grace Cancer Foundation. I think there's been a collaborative effort, all right, from various organizations, be it be NGOs, academic institutions, right, big tech corporates, all are coming together just for one platform, that is AI in healthcare, with a simple vision. The theme for this year is amazing, Dr. Lakshmi. This is basically we are looking at empowering precision and personalizing care, because it's all about now precision medicine. So one size does not fit all. I think we have moved on from that stage. So that's where I think precision medicine and personalized care is what is the theme for this year too. And 2.0 is going to be an exciting confluence of great minds from across the world.
So it just gets bigger every time and every year. So I think that with this we can conclude and we can safely say that it is not AI versus doctors, but it is AI with doctors.
Absolutely. I think that's a great summary, Dr. Lakshmi. Yeah. Co-pilot, coexistence, and together, collaboratively, we can give better outcomes to our patients.
So thank you, Dr. Chinnasa. It was wonderful for a fascinating talk, and thank you so much.
Thank you.